Hello and welcome to another edition of the Harley Street Health Podcast. Today I'm going to do something a little bit different. It's just going to be me, and I'm going to be talking about something that comes up really commonly is the difference between coronary artery disease, heart attacks, and heart failure. It's often confused. They're often heart attacks confused with heart failure and vice versa. I'm just going to go through very briefly the difference between the two and how they come around and how they're also related. And in addition, I'll also include some questions that, if you have this condition or your family has this condition, I'll give you the kind of questions you should ask the cardiologist that looks after them. So I'm just going to, for those of you watching the video, I'm going to share my screen. I've got a few slides here just to illustrate some of the concepts. So first of all, I guess the most basic thing is what the heart does. It's a pump, and it's a muscular pump that pumps blood around the body. It gets blood from the organs that's got no oxygen in it. It pumps it into the right side of the heart, and the right side of the heart then pumps it up to the lungs through the pulmonary artery. And then it gets filled up with lots and lots of oxygen, comes back to the left side of the heart, and the left is the main pumping chamber, and it pumps it out through the aorta, the big blood vessel at the top of the heart, and then it reaches all the organs, the brain, the kidneys, the liver, and it's about the size of a fist, and it beats about 100,000 times per day, so it has to do a lot of work, and it pumps about 5 to 6 liters of blood a minute, so it's quite a remarkable organ. And to function as a muscular pump and actually pump blood just one way through the heart, there are a number of different valves that only allow the flow of blood to go through in one direction. So one of the key things about the heart is that the heart itself needs to have a blood supply, and it gets that blood supply from things called the coronary arteries. And there are 3 main arteries. There's the one called the left anterior descending, one called the circumflex, and one called the right coronary artery. And these 3 main arteries, they originate just at the top of the heart, just as the blood comes out of the aortic valve at the bottom of the aorta, and these arteries supply the heart muscle with blood. And the thing that causes most of the problems, or what people tend to cause heart disease, is this process called atherosclerosis. And it's basically, this is the process of when we build up fatty plaques within our arteries. So you have normal arteries that have a nice smooth surface with normal arterial cells lining the surface. And then you have arteries that have these lipid deposition. It's a deposition of kind of fatty lipids and cells. And this is a process called atherosclerosis. And it can happen in any artery in the body. And if it happens in the heart arteries, it's called coronary artery disease. And if it happens in the neck or in the peripheral arteries, it's called peripheral vascular disease or cerebrovascular disease. And regardless of where this process happens, the main risks that drive this process are smoking, high blood pressure, high cholesterol, diabetes, obesity, inactivity, not doing any exercise, family history, and age. And as basically pretty much all of us develop atherosclerosis, and the older you get, the more likely you are to have atherosclerosis in the arteries. Some of us, because of all these different risks, risk factors that we have, get atherosclerosis earlier than others. So this is the process that leads to coronary artery disease. So this process of atherosclerosis happens in the heart arteries. And it's important that you know that, because I'm going to describe now what a heart attack is. So when you have this buildup of fatty plaque in the arteries, you have, it has like fatty plaques, and there's these cells called foam cells. And these plaques usually just sit there, they're quite stable. But for whatever reason, for some reason, we're not entirely clear why, some plaques, they become inflamed. And when they become inflamed, they have the potential to rupture. And when they rupture, the contents of the plaque get exposed to the blood. And when the blood sees the contents of this plaque, a clot forms in the artery. It starts off with platelets and then blood cells and lots of clotting factors, and it forms a clot. And this formation of a clot very quickly, it blocks the flow of blood in that artery. And if that happens in the heart arteries, that is what a heart attack is. You have acute blockage of blood flow. So an area of your heart muscle does not get enough blood. And you feel that, often you'll feel that as chest pain or acute breathlessness. And sometimes that can be a complete blockage where it completely blocks off, you get severe chest pain. Sometimes it can block off and then some blood will get through and so you get pain, then it goes away. And you get more pain, it goes away. And there are two different types of heart attacks. So it's pretty common, and this is why heart disease is so important, that it's the #1 killer in the world, with 17 million deaths every year caused by cardiovascular disease. And about 1 in 3 deaths in Singapore are due to cardiovascular disease. It's in 2018, about 25% of deaths were due to heart disease alone. And in addition to deaths, these heart attacks result in death of a portion of the heart muscle and can lead to conditions like heart failure. So just to go over what the symptoms and signs of a heart attack are. Heart attack, the pain usually happens suddenly. The symptoms are very variable, but in most people there will be some form of chest discomfort, often described as a squeezing or a pressure pain or a heaviness in the chest. It can sometimes radiate or move up the jaw or the neck. And then you get some associated symptoms. So often people will describe sweating or shortness of breath, or they'll feel sick and they'll feel giddy and lightheaded. But it is variable, and some people only present with breathlessness, and some people don't get any symptoms at all. But most people will get chest pain. So how do we diagnose it? So what I will say is that if you have any type of chest pain or breathlessness or anything that you're worried about, you should get seen quickly, because the treatment of a heart attack is better if you get seen quickly, and it prevents deaths the quicker you're seen. And when you go and see a doctor or go to A&E or call an ambulance, they'll do a couple of things. The first one will be an ECG tracing. And this is basically, you'll get hooked up to a few little leads. And these will measure the electrical activity of your heart. And if you can see the screen here, this is an ECG of somebody who's having an acute heart attack. And they have these kind of squared off segments of the ECG that are called ST elevation. We also do some blood tests, and there's some super sensitive markers of heart damage called troponin that we do these days. So we base our diagnosis on the history of the patient, the history of acute history of chest pain or other symptoms, an ECG, and some blood tests. So if you're diagnosed with a heart attack, what happens? So the first thing that happens is usually you're given some blood thinners, because this disease process is a clot forming in the arteries. And so what we do first of all is we give blood thinners to try and reduce the clot that's forming. In addition to other medications that you will be getting while you're in hospital, you'll get cholesterol-lowering medications, regardless of what your cholesterol is at baseline. You need to have a cholesterol-lowering medication, and some other medications to help your heart recover. If this is a complete blockage of the artery, we recommend patients get emergency coronary angiography and coronary angioplasty. And what that is that you get a wire put down the artery, and if there's an acute blockage, the wire opens up the artery, and then a balloon is used to open the artery up, and then a stent is implanted at the area of the blockage just to keep that artery open. And in people that have a certain type of heart attack called an ST elevation heart attack, that's a complete blockage. It really is super important to have that artery opened up really quickly, because the longer that artery is blocked, the more damage is done to the heart and the greater risk of death and heart failure. So why it's so important, if you do have potential symptoms of a heart attack, you need to get seen quickly to try and prevent damage and reduce your risk of problems in the future. If it's a partial blockage, then there's a little bit more time to do an angiogram, and often it'll be done within the first 2 or 3 days of you being in the hospital. But the important thing, again, I'll reiterate, is to actually have an ECG and have the diagnosis made, so they can decide how quickly you need your artery opened. So if you've got a friend or a relative, or yourself, and you're in with a heart attack, what should you say, and what questions are relevant you should ask your doctor? The first one would be, how many arteries are affected? Sometimes it's just one, and you need one blockage opened up. Sometimes there's lots of blockages, and sometimes people need to have a surgical operation to help alleviate all the multiple blockages. Or other times, if there's other blockages, they can be opened up maybe a month or so later. That's related to the next question, is will they need further procedures? So you come in, you have your first procedure done, and sometimes you need to have a second procedure, which will often be scheduled at a later date. It's good to ask your doctor how much damage there's been done to the heart, and often they'll quote you in something called the ejection fraction, and the ejection fraction is basically the percentage of blood that's ejected from the heart with every beat, and normal is usually above 50 or 60%. And if you have a low ejection fraction after a heart attack, it suggests that there's an area of the heart muscle that's not moving properly, so it's unable to eject blood quite as efficiently. Another question to ask is, what's the cholesterol? If it's, you will be on a cholesterol lowering tablet, but if you have a very high cholesterol when you come in for a heart attack, then it suggests that perhaps you may have some form of genetic high cholesterol, which has may have important consequences for your family. Another question is, can you go into the cardiac rehab program? Basically, the cardiac rehab program is a set of exercise classes and educational classes which helps people get back on their feet and get back to where they were before they had a heart attack. Really important way to promote rehabilitation. So in summary, a heart attack is something that happens generally quite suddenly when a coronary artery plaque ruptures and a clot blocks the artery. And the chest pain itself is the commonest presentation, and it usually requires coronary angioplasty, or a balloon blown up in the artery, and medication to treat it. And I'll add to that, if you have a heart attack, you will be on medication, a number of different medications for life. So how does that differ from heart failure? So basically, heart failure can often be the consequence of a heart attack. But heart failure can be caused by lots of other different things. And it's basically a syndrome in which the heart is unable to pump enough blood to meet the metabolic demands of the body. And if you think about it this way, when the heart pumps blood at rest, the body usually doesn't require too much blood at rest. But as soon as you are running or stressing, your body requires a lot more blood. So the heart has to pump a lot more blood. And if that heart is not working efficiently at pumping, it can often not get enough blood to the body at times of stress, which is why with heart failure, people often get symptoms when they're moving or stressed, and they can often get breathless when they're walking or exercising. There are lots of different causes of heart failure. I guess the first two is heart attacks. If you have a heart attack and you damage some of the muscle of the heart, you're left with a heart that doesn't work as well and it's not as efficient. The other big cause is high blood pressure. And people that have high blood pressure that's not treated well can often be left with heart failure. you get intrinsic heart muscle diseases where there's actually a process going on in the muscle which means it's not working properly. And this can often be a genetic condition. And any disease that affects the heart valves, now remember the heart valves are there to direct blood, so it only goes in one direction around the heart. And if you have a disease of the heart valves where they can be leaky, or blood goes backwards, or those heart valves are super tight, that can cause heart failure as well. There are some heart arrhythmias, and that's when the heart goes very fast or very slow, that can lead to heart failure. And some people can be born with problems in the heart, like holes in the heart, that can also lead to heart failure. It is surprisingly common, and a couple of the key drivers, particularly in Singapore, are diabetes and hypertension. And these two risk factors are very common in Singapore, which is one of the reasons why around about 4 to 5% Singaporeans have heart failure. It's almost 1 in 20 of the population. And that's compared, it's almost double that's seen in the United States. In the United States, only about 1 to 2% of people will have heart failure. And the really worrying thing is that Singaporean patients with heart failure tend to be younger than European patients. There was one study that looked and compared Singapore with Sweden, and Singaporeans had heart failure at an average age of 62 in comparison to 77 in Sweden. So this is a disease that is more common in Singapore and affects people at a younger age. So what is heart failure, and what would the average patient feel like? So first of all, in most cases it comes on slowly. People tend to get short of breath when they're exerting themselves. One of the symptoms can be tiredness or extreme fatigue. You can get short of breath when you lie flat, and sometimes you can wake up short of breath at night as well. And some of the signs that you might feel in your body are perhaps swelling of the legs or ankles, perhaps getting worse over the course of the day, swelling of the abdomen, maybe some wheeze and crackles in your chest. You might notice your heart rate a bit higher than usual, or your blood pressure being a bit lower or higher. Now, I say that usually it comes on slowly. It does. For some people, it can come on quite suddenly, where they suddenly feel breathless and they end up needing to come into hospital. So how do we diagnose it? Well, the first thing is we talk to the patient, we find out their symptoms, we examine them and look for any signs of fluid overload. But the key tests for diagnosing are doing an ultrasound of the heart or an echocardiogram, and some blood tests, which allow us to look for evidence of heart failure. And these are really two simple, non-invasive tests that allow us to come to the diagnosis. And then once you have the diagnosis and you've looked at the heart and you found the problem with the heart function, you can look for the cause. And the key causes are heart attacks, high blood pressure, heart muscle disease, problems with the valves, heart arrhythmias, and congenital heart defects. And a lot of these can be picked up in the initial evaluation with the blood pressure, and the echo. And regardless of the cause of the heart failure, it's generally treated the same. We kind of divide heart failure up into people that have poor heart muscle function or a low ejection fraction, and people that have high heart muscle function, have a normal heart muscle function. And that kind of division determines what kind of drugs you get. There are a group of drugs specifically for people with low or poor heart function, which do improve outcomes. They reduce heart failure symptoms, they reduce hospitalization, and they make you live longer. And I should say that this condition 20 or 30 years ago had a prognosis that was awful. All we could do was give medication to get rid of the fluid overload, and the prognosis was worse than cancer. And things have improved, and we've got a lot of treatments now that can actually improve your outcomes significantly, from beta blockers, ACE inhibitors, a new drug called Entresto, even newer drugs called SGLT2 inhibitors. And all these packaged together can significantly improve how you feel, and in some cases improve the heart function. So it is a disease now that's actually very well, it's a lot easier to treat than it was in the past, and there are a lot more options for treatment. There's also a number of procedures that you can get that can help if you have heart failure. There are types of pacemakers that we can give. One of them is called cardiac resynchronization therapy, which basically paces the left and the right side of the heart, and it makes you feel better and makes you live longer in a small number of patients. You have to fit very specific criteria to actually warrant one of these pacemakers. We also have defibrillators that can shock your heart if you develop a very fast heart rhythm, which can sometimes happen in a small number of people with heart failure. And these can be implanted under the skin. Some people can have, if it's caused by coronary artery disease, then having a bypass operation can help. And if you have a heart valve problem, then a heart valve replacement can sometimes help. And if you're still breathless despite all the medication, you can often go for something called a left ventricular assist device, which is essentially a pump that takes over some of the work of the heart, or a heart transplant. So if you or a friend or a relative has heart failure, what are the key questions that you should ask? So the first question would be, what is the cause? You know, what's happened? Why do you have this disease? Because sometimes when you know what the cause is, it gives you a help and a guide as to how you can treat it and how you can cure it. What is the ejection fraction? If it's above 50 or below 50, is it reduced or preserved? Because this guides your treatment quite significantly. Good question to ask is, are they being given beta blockers, Entresto, spironolactone, and SGLT2 inhibitors? These are the key drugs that modify the outcomes of this disease. These drugs improve outcomes and make you feel better and are very important. Another question is, are they a candidate for the special pacemakers, the cardiac resynchronization therapy, or the implantable defibrillator? Not everyone with heart failure is a candidate for these devices, and there's a very specific criteria for their use. So, but it's a good question to ask your doctor to ensure they're being considered. Another question is, are there any surgical options? Most people with heart failure, there are no surgical options like revascularization or valve replacements. There are certain groups of people that do benefit from surgical procedures. It's worth asking that question to your cardiologist. And another question is, do you think there's a chance the heart function may improve? You know, it's actually, although you might ask that question, it's quite a difficult question to answer, because some people do improve and about a third of people will improve, but a lot of people will not, and some will get worse. But there are certain conditions that are a lot less likely to improve than others. If someone has had a very, very large heart attack or multiple heart attacks, and there's a lot of scar tissue in their heart, and they're probably less likely to improve their heart function over time. So a quick summary on heart failure. So usually it presents more slowly. The heart fails to pump enough blood to the body, often at times of stress. And this results in breathlessness, usually when exerting themselves, and some leg swelling. And the cornerstone of therapy for heart failure is medication, and some patients can need a procedure. So that's the kind of the end of my chat about this. I think kind of key take homes are that a heart attack is related to a clot in the arteries of the heart, which acutely stops blood flow to the heart and can lead to damage. Heart failure is any process where the heart is failing to do its job properly and not getting enough blood to the body and the organs. And often both of these conditions are driven by the process of arterial disease or atherosclerosis, and that is when you have the damage to the arteries and the fatty plaques, which often lead to these two final processes. So I hope that's been helpful, and if you have any questions or want to talk about these conditions, then we're always available through our website. I'll put the links down below. Thanks for joining us today.